years, Peggy Pepper struggled to control her bladder.
I used to use the pads, medication for a year, and it didn't help.
When the voiding dysfunction is not mechanical, meaning nothing's wrong with the body, it may be a neurological problem where the brain and bladder nerves stop communicating. Many people do well on medications, but others, like Peggy, don't. So doctors may opt for a high-tech bladder solution.
In this subset that we're talking about, we test them, make sure they fit the qualification for the procedure, and then we'll go ahead and later on implant the pacemaker, which is basically, I call a pacemaker for your bladder.
The interstim device can fit in the palm of your hand. It's implanted beneath the skin in the hip area. Wires send mild electrical pulses to the sacral nerves which control the bladder.
It's almost like telling the nerve to be quiet because you keep tapping on it. Eventually it gets a numb effect. It sort of calms the nerve down.
Patients control the amount of stimulation with a handheld programmer which talks to the neurotransmitter inside their body. Together they make up for the lack of conversation between the brain and nerves.
It feels like you're holding it in, but not forcefully, that it's just there and waiting. Rather, as before, you'd have to run for it.
If you're leaking and you're having to wear Depends or having to go to the bathroom every hour to hour and a half or 2 hours, you don't really have a lifestyle. People have basically given back their social life.
The procedure is a game changer, which has put more than 100,000 people back in a position of power. For Lee Memorial Health System, I'm Amy Osher.